Today we have a very special guest who's been an integral part of our community. I want to say for close to 5 years. He's the expert at our members and any of ourselves, the trainers, we turn to when we're dealing with tricky aches, lingering pain, weird sensations, old injuries that won't let us get back to normal. Uh, he's our resident pain specialist at our gym, Harrison. Oh man, and you just said it, and but
Kuehn.
Kuehn.
Very nice. Yes. Thank
Oh
you.
man. Anyway, he runs his practice here at Real Fitness. He's had countless success stories with helping our members move better, feel stronger, and we're thrilled to have him today.
Yeah.
We're gonna go dive into the demystifying pain, share his insights, and then help us understand how to navigate our signals, our body signals when something's going on. So, without
Yeah.
further ado, let's get schooled. All right, Harrison, welcome.
All right.
Thanks so much, guys. Thanks for having me. I'm super excited to be with you.
Yeah, we're excited. Thanks for doing this. And also a little
Yeah.
side note, this is going to be one of three series that Harrison's going to be doing for us. Today's all about the back, probably lower back specifically, but I'm sure there's going to be more talks about the T-spine, and I'll let Harrison do it. And then next one's going to be shoulder and knees. So Harrison's
Okay.
going to give us a lot of great information
All right.
there.
Good.
Yeah.
Right before we get started, you want to add anything that I missed out from that great introduction, Harrison?
Yeah, that was awesome, man. That was so great. Thank you so much for that. Yeah, I think you hit the nail on the head in terms of, yeah, where our relationship is, and even prior to that, I basically was schooled in and started my career in the school systems. Is how athletic trainers are typically trained. You start with a school. So I was at Ohio State, and you're in clinical rotations. It's basically like trade school. So you're working with athletic teams. So that's how I was sort of born and raised in this industry. And then I moved into private practice back in 2018, and that sort of changed a lot about how I practice. And then obviously moved down here to Los Angeles in 2020, and met you guys, and the rest
All
is
right.
history.
Yeah.
So yeah, just might give some color to sort of the situation and to what an athletic trainer is. Nobody really knows what that
No,
is.
no, we don't, and we're gonna dive into that. But that
Yeah.
question of getting to know you a little bit,
Okay.
checked.
Good.
We just got that off the
Yeah.
list, so we're off to
Awesome.
a head start. All right, then I'll start with the get serious questions here,
Hit
um,
me.
so that way we can really dive into it now. So, with all your years as an athletic trainer, what is the most common ways people accidentally hurt their backs, and when they're working out or moving every day, like what are the common things here that we're seeing?
Yeah. I think the biggest thing is that most people's backs are probably doing too much work. They're probably not getting enough help from everything else. Now, in the gym, what that might look like is, let's say like a lower body movement, like a squat or a hinge, right? For a lot of people, they might not have great hip range of motion or just great, patterning, sequencing, whatever you want to call it, in certain movements, so that their back might end up doing a lot of the work for them in those movements. So, like, if we're taking the squat, for example, right? If they're going too deep, like deeper than their hips can go, they're deeper than their hips can take them, then obviously the hips run out of room. The movement's going to move up to the pelvis and then into the lumbar spine. And then, that's maybe as they're going down to the bottom, to the depth of a squat. Then as they come back up, that flex position has to then extend. So
Ah,
anytime there's movement, there's going to be, work basically. And so for a lot of people, and that's all to say, like, movement in the back is not a bad thing, right? That's a normal thing. That's a good thing. But when you have that plus a lot of load, sometimes that back just takes over and we're not training as much of the other stuff. And I would say, to kind of summarize that, even the biggest thing, or at least one thing I see really commonly in those movements, like a squat or a hinge, would be that people are extending their back on the way up. Let's say, like they're kind of lifting their chest and coming up,
mm-hmm,
so to
mm-hmm.
speak. through that, as opposed to actually extending their hip, like getting their
Extending the
hips to
hips,
come.
right,
Right. So,
right,
so we always feel like, hip before back or bum before back when
right.
we're talking about, the sequencing that we want to have, whether that's, a squat, a hinge, a step up, a lunge, a walking
Hmm.
lunge, maybe a sled push, all of that, is good opportunities to work on that sequencing of letting the hip actually extend before the back
And that
does.
can happen, and that can happen at the kitchen. That can happen pretty much any part of
Yeah.
your life.
Absolutely.
It's the actual movement that
Mm.
can cause it. So we have to be aware of our movement patterns constantly.
Totally. I
But
mean,
but but
and,
but but good
yes and
habits
no.
creates good practice
Correct.
creates good habits. So
Correct. I would not want someone to be all like perennially concerned about every little movement that they make. I think
Yeah.
that's pretty common for someone who, like, honestly, a
Yeah.
lot of my clients who've been in pain for a long time, and it's like they just have to second guess everything. And so that's where really good training comes along. If you do really good training, that's where you build confidence, you build the patterning, so that ideally you don't have to think about it, because our brains aren't meant to be concerned with every little movement. A lot of it's supposed to be just automatic,
I
right?
kind of
And
Yeah.
that's how it
yeah.
be. But to your point, Lucho, like for a lot of people that I see, it's loading the dishwasher or unloading the dishwasher, right? Reaching down, or even like going to wash their hands. They just kind of
Right,
bend over, wash it, and then come up, and it's like,
right,
oh man, pretty immediately. So, and again,
right,
that can also be just like it's just hit the threshold, right? Let's say whatever they're doing in their day-to-day life, their work life, and then they're exercising, maybe they're not, but it's just like, the back's doing more and more and more, and then it can hit a threshold where it just basically, that
right.
back just kind of gives
Yeah.
out. It's just like
So
enough.
right. So it's like eating bad. If you keep eating bad, it keeps adding up. You keep
Yeah.
Yep,
having bad
that's
habits,
right.
it keeps adding up. Just another
That's
way
Yeah.
of
right.
looking at it. All right. So
Yeah,
really,
that's a really good
as
analogy.
a traders, we got to get better at telling them. All right. If this is how you clean the dishes in the dishwasher, you're doing it all wrong.
Yeah. Right. Now we got to go to your house and watch you
Now we
clean the
gotta fix.
dishes. You
We
know.
gotta man. We gotta start from scratch here.
So
Yeah.
like if you're watching somebody doing a deadlift or a squat, like you
Mhm.
want to see the initiation from the low spot coming back up, right? You want to see the hips start to move first before you see the back start to move. Is
That's
kind of what
right.
I'm hearing.
Yeah.
Yeah,
Yeah.
yeah. First and all the way through, basically.
Right.
Like it should, the back should move sort of because the hips are moving.
Right.
Right.
Um, and a lot of times, what I'll see is, even if it's like an initial, like they do get the hips to come forward,
Yeah.
which doesn't, it's usually not. But then sometimes they get, like, let's say halfway up, and then the chest comes up, and they
Right.
basically extend back to finish the movement, and they feel like, oh, cool, I made it to the top. My hands are back where they started, but
Right.
their butt is still 3 inches behind them. So they
Right.
never actually got all the way through. So it can
Yeah.
Cueing.
happen to a point at the very beginning, where sometimes the hips never come through and they just lift up. But I see it all the time in people when I do, like, just a body weight hinge. I say, like, okay, let's see your deadlift. Especially if I do it like on one leg, or a kickstand. But even two legs, like, it's pretty common to see without the weight. It's like, okay, the hips go back, hopefully, on the way
Right.
down, sometimes not. And then on the way up, it's like the hips never make it back to where they started.
Right.
So that's just a good example of something that I see, like, from in the gym on a pretty regular basis. But there's all sorts of things, where you see those patterns.
Yeah. And like the positioning of the back, for instance, if somebody sort of slightly rounds the shoulders forward, and that's just kind of the way their shoulders sit on their trunks, but the hip is, you would say, like, that's not really something to worry so much about, as long as you find that the hip is initiating that movement. Is
Yeah,
that
I mean,
something
it
you would agree
definitely,
with, or that's a whole nother?
I think it's something to note. Like, yeah,
Yeah.
you don't want to be super flexed all the time, but I think
Right.
it just kind of depends on the person and, the certain movements. Like, honestly, I have to teach a lot of people to slouch. Many of the clients that I have,
I
because I
see
can,
you doing that a lot, and
Mhm.
I'm
yeah,
like, what?
yeah,
Yeah.
you're like, what? That seems so
Yeah.
backwards.
It's counterintuitive.
Yeah.
Yeah. Exactly.
Yeah, but for a lot of people, they can't, because, right, you have to have a give and a take. But if the back is constantly working, and let's say like military posture, for example, right? A lot of us were taught, chest proud, shoulders back,
Boom.
really, like,
Right.
sit tall and don't slouch, right? I think it's one of those things where maybe we went a little too far with that. And if you're always holding yourself up in that position, well, guess
Yeah.
what muscles are holding you up in that position, right? So
Retraction.
Right.
All that.
Right.
are just constantly. It'd be like
Yeah.
if you walked around all day flexing your bicep. It's like, yeah,
Right.
your biceps are going to look toned and be pretty strong, but it's like they're not necessarily meant to do that. Like your back's going to be working a little bit when you're upright because it's your erector, so it's going to be working
Yeah.
to keep you erect, but it's not something that you want it to be working super hard all the time, because that's that threshold I was talking about, right?
Mm-hmm.
If I
Yeah.
see someone like that and I'm like, oh man, you just got to let go for a bit. You got to give them a day off.
Yeah.
Nobody's
Right.
working, 365 days a year, 24/7. That's like, that's
Yeah.
a good way to burn out a human being or your back muscles or really anything. It's like you need them to be able to like let go and rest with any muscle, right? So
Right.
Yeah.
Right.
to contract it, of course, right? That's super important. And that's kind of like what we're teaching people to do a lot of times, is like how to build force and build tension. But with a lot of the clients that I see, maybe half of them, it's like I have to teach them how to let go of
Let
tension.
go.
Mhm.
Wow. Let go.
Yeah.
That's where the slouch really comes into play. And with the
Yeah.
slouch in particular, often I'll use that as like a training tool. It's not like, hey, we're not going to go like do super slouchy deadlifts under load, but
Right.
I might have them do it body weight and get them all the way rounded out and have their chin to their chest and just have them be, very slouchy. And then I might have them do like a sit to stand, like a squat or
Mhm.
something like that,
Mhm.
The goal of that being, I've taken your back now and I've flexed it all the way, because all you want to do is extend it. All you want to do is get upright. And so if I take that strategy away from you entirely and I make you stay curled into a ball, you have no choice to come up but to use your hips
Use your
and
Your
hip.
hips. Your hips. Yeah.
Right.
Yeah.
so
Yeah.
it's kind of one of
Huh.
those. I'm going to go,
Reprogramming.
I'm going to feed I'm going to take away your favorite strategy and I'm going to make
Yeah.
you find a different way.
Yeah.
Because
Oh.
if you're so used to being chest proud, lifting with your back, I got to take that away from you just for a little bit, just as a training tool, so that you
Yeah.
can understand, like, oh, that's what it feels like.
That's the
That's how I
sensation, right?
Yeah.
Yeah.
Yeah. Yeah. Yeah.
that's how I
Yeah.
get my hips fixed,
Yeah.
right?
What
So
do you think about like Jefferson curls and things like? Do you think that's a good addition to sort of along of what you're saying, just to teach people that rounding the spine
yeah,
is
yeah.
like it's okay?
Yeah, for sure. I think it's a great exercise. I think, it's one that goes more along the bucket of like where traditional rehab really fails people, which is like, okay, shoulders, knees, hips. It's like we got to restore full range of motion. And then as soon as you get to a back, it's like, don't let it move.
Yeah. Don't
Keep
ever
it.
move it. Yeah. Exactly.
Yeah.
Every exercise we do is going to be anti this, anti that, anti
Yeah.
flexion, anti extension, plank, whatever, like anti rotation. It's so funny that like for that series of joints, we're going to change the whole playbook on
Right.
rehab.
Yeah. I know.
So
And even
Yeah.
like coiling too. Just
right,
that
yeah, yeah, you have to
that
have
lateral.
Yeah.
Yeah.
It's more like reprogramming the way we cue. It's like this, like learning to stabilize, but disengaging here so you can engage more there.
Yeah.
right, right,
It's
yeah,
like
yeah. I mean,
reprogramming that part of
mhm.
teaching.
Huh.
I think any healthy joint, should have full range of motion, right? So for a low
Mhm.
back, that's going to be some flexion and extension, right? Bending forward, bending back. That's going to be some rotation, twisting left and right. That's going to be some side bend, like you were talking about,
Yeah.
Mike. And that's those are your three planes of movement, basically. So your
Yeah.
back should be able to do that. And if you can do it body weight, that's kind of like the first step. And then on top of that, like, just like anything else, if I can, reach my arm overhead, great, that's a good thing. But I might, eventually want to add weight to that to make that more resilient, to build the muscles in that capacity. So that's kind of your
Yeah.
Jefferson curl right there, is like you're taking, a very primary movement of the spine and you're building resilience. So that's maybe not something that I would do super early with somebody. In my world, but I think for you guys, if you're taking somebody who's really healthy, for personal trainers out there, if you're taking somebody who's healthy, whose like back is feeling good and not
Mm-hmm.
having pain, and you're just being smart about how you gradually progress it, starting body weight, let them get the movement right, and then slowly add weight over time. Like, I think it's a great thing. I think it would probably keep people out of, back pain. Because like I said, for some people, it's that their back is doing too much work, right? But for a lot of people, they just have weak backs, and
Right.
let's say that, every time I see a back, it's like, okay, we got to strengthen. That's not always the case, but I think for anybody, if they're not having back pain, if you can start to be proactive about it and actually build some
Uh-huh.
resilience, that's always a good idea for any joint.
Okay. Good.
So, what are some of the verbal cues that you would get from
Mm-hmm.
people? Because we get told all the time, like, "Oh, my back's tight. I got a little pain here. This side is flared up." Like, what are some of the verbal cues that you would say would differentiate between somebody that is complaining about an issue with the back that we as trainers can work with, or what are some of the verbal cues that you go like, "Oh, wait a second, I think you need to go see
Yeah.
somebody like you."
Yeah.
Yeah.
This is.
This is kind of a tough one because I think it really depends on the person. Like, hopefully, it's a person that you've been working with for at least a couple weeks, so you kind of got to know them a little bit. The
Yeah.
better you know the client, I think the better you can be at helping them through that. Because if you know them, you may know like what their relationship is like with pain, or with if there's someone who comes to you every single time and there's always something. It's like, okay, that's going to change a little bit about how you perceive it. So I think, does that person have a good understanding of like what muscle soreness is versus like, pain, like something's wrong, like I shouldn't move my arm.
Yeah. I will
Mhm.
get people say like, "Oh, my back hurts." And
Right.
sometimes I got to be like, "What do you mean by that? Like, is it
Yeah.
just
Yeah.
sore or,
Just ask a ton of questions would be my first my first
yeah.
piece of advice. Like, honestly, the more questions you can ask, the better, because you might even ask something that doesn't even relate to what they're going to tell you next, but like things just come up for them. But I think the biggest thing is like, if you can ask questions and understand like, okay, did you do anything outside of our training that would have potentially, like, is there any mechanism of injury, is a really good thing to know, right? Like, if is this just a vague out of nowhere thing, or is this something where like, yeah, actually I went and surfed for 3 hours yesterday and I haven't done that in 4 years, so, oh, okay.
Right.
Well, that's,
Oh, good to know.
yeah, like,
Yeah.
real often I
Yeah.
will just
Yeah.
ask, and then there it is. It's like, aha,
Right.
and they don't even think necessarily that that's something that's like could be connected sometimes, but you can see it in plain sight. So I think
Yeah.
asking questions is a really good thing. I think understanding mechanisms of injury, I think looking at the program that you did with them last is really important, and say, okay, what do we do? And
Mhm.
which of these things maybe contributed to it, right? So I think that's a big thing, is to be looking at your own programming. I do this every time it happens to me. I'm like, all right, let's look back. Oh, okay, that was probably this that we did, and either maybe you weren't ready for that, or you weren't ready for the volume that we did there, or whatever it is, right? So
Yeah.
understanding the recent training history, but in terms of like other things that they might tell you, you want to be asking questions about like, where do they feel it too. If
Yeah.
it's
Right.
right on the spine, that's really valuable information. Usually that's not awesome, especially lumbar spine, if you can, like, right on the bone, essentially,
Mm.
the vertebrae. If it's sort of off to the sides a little bit, like where the erector spinae group is, I think that tells you a little bit more about what you need to know. Is it a broad area? Is it like their whole lumbar spine? That often would indicate maybe.
Right.
Oh,
Uh-oh. What just happened?
Sorry about that.
um, so if it's a broad area versus a very localized area, like, yeah, I feel it right here. Usually the localized areas, I would say, a little bit more cause for concern. So and I think with a lot of people, it's just understanding like, let's see how it progresses over the next couple of days. So
Yeah.
you
And I
guys
would
just,
imagine like to that point, like chronically talking about like
yeah,
back pain would be like, okay,
Mhm.
maybe it's time now for you to go see, talk to you and
yeah.
have you do your, yeah.
Yeah, especially chronic stuff in particular. Like, if they've never come to you with back stuff, and all of a sudden it's like, oh yeah, my back feels, again, painful, tight, sore. These are the things to try to like really differentiate. And it's really tough. It's subjective, so it's like you can't get in their body and feel it for them. So you have to
Right.
ask some questions to understand, like, have you ever been in pain before, right? Like, have you ever had back pain before? Does this feel similar to any other experiences you've had, right? And then, in terms of tightness, like, that's so hard to discern. Like, things can feel tight and be weak or be actually short and or really tense or what have you. So understanding like what their history is and like if they've ever had experiences of feeling tight before or pain before or stuff like that
Mm-hmm.
is very helpful. But yeah, location of where it's going on is very interesting. Like to me, how long has it been going on is very interesting to me. When do you feel it? Is like first steps out of bed in the morning? Are you having night pain? That's all really important stuff. Any like numbness and tingling anywhere? Do you have any radiating pain shooting down the leg? That's really important to know. Anything going into the groin? Any like bladder, bowel dysfunction or issues or stuff like that? These are the type of things where it's like helps if you know them a little bit and you can get to that level and feel comfortable asking those questions. But a lot of times people, like I said, don't connect those dots, and it's right there. You just have to ask the question. So I would take an extra 5 minutes if you can when they come in and like really try to just ask, okay, where does it hurt, and anything else you can think of that might have contributed to this, and okay, do you get anything else besides like right on the spot? Like, is it moving anywhere? Do you feel it different places, different times of the day? Is anything going down your legs? Is anything going anywhere else? That's kind of a little like question sequence I would take a couple minutes to run through them with. And if it's their first time, I would just go a little lighter that day in terms of, try to keep them maybe a little bit more, upright, so to speak, in your lower body movements, and just try to be kind to the back, and then just see over the next couple of days, is it getting better each day? Is it persisting? It's usually not super emergent in, I think, the case that you're talking about. But it's just something you definitely wanted to monitor. And if it continues to persist, like you were saying, Mike, that's
Yeah.
when you want to send. Mm-hmm.
Could something trigger at the gym if we don't ask these questions or we don't engage with them like you did anything physical? Then they did, and they didn't tell us, and then we did something in the gym that could trigger it. That concerns me when I used to train. When I was training, I would ask them how was the weekend doing. Did you do anything physical?
Mm-hmm.
I would ask them that just to have like a heads up, like, oh, you're sore here and here probably, or you did too much of this.
Yeah.
Just to screen them without them knowing they're being screened.
Right.
Yeah.
It's nice, it's good conversation. It's, builds rapport, builds trust, but also you're gathering information, which is great. Yeah.
Right.
Yeah. This leads to this question here. How can someone who works out regularly tell the difference between a typical muscle soreness, the good pain, and bad pain? That means they might actually be injuring themselves and should stop, or what's going on here?
Yeah, you're right. That does lead perfectly into that question. That's so tough. And I think it's very different person to person. And I think the more time someone spends in the gym or just, exercising, whatever they do, I think that just gives you more and more information about, what is pain versus. So for someone who, let's say, has is an athlete or has an athletic background, I would expect them to have a little bit more awareness of like what feels like, yeah, this is hurting versus, it feels like it's harmful versus, just good muscle soreness. I think also, a good guide for you as you're asking questions and trying to figure that out with your client would be, again, location of it, right? Are you feeling, okay, yeah, like this feels really sore today. Okay, or my knee, or, my knee feels really sore today. And you're like, okay, well, where exactly? And then they point, 6 inches above their knee on their quad. And you're like, oh, okay, nice. Well, we did,
Right.
heels up squats 2 days ago. So that's
Yeah.
kind of like target hit, target acquire, like that's kind of where we were aiming, right? Versus, okay, my knee hurts. Okay, well, where does it hurt? And they point, 2 inches below the patella on the patellar tendon. You're like, okay, that's good to know. Did we do some jumping? Did we do,
Right.
too much knee bend stress for them at
Yeah.
that time? So that's kind of like, I would say a good thing to know is like, if it's in the muscle belly, I'm usually pretty comfortable with it. Especially if it's like extremities. Again, like if we're talking the muscle belly of the erector spinae group, the low back muscles, like I don't love when that's super sore, but again, it's
Right.
not the end of the world, right? It's probably fine stress for them as long as it calms down in a couple of days. But yeah, if it's anywhere on bone or on tendon, I'm like less excited about that,
Mm,
I'm
yeah.
less enthused, because for a lot of people, that's really like, that can be a good thing when they come in, they're like, hey, wow, my arm really hurts. And you're like, okay, well, where does it hurt? And they point to like the center of their tricep. And you're like,
Hmm.
well, cool. We did like push-ups and tricep extensions, yesterday. So that's like kind of the muscle group that we were. So then you can be like, hey, that's actually not like the worst thing ever. That means we hit the right muscle. Did we maybe do too much? Perhaps, but maybe we don't. Maybe we're still figuring each other out and seeing how much you can do. So I think that can be a good experience for someone to be like, hey, when you feel stuff, not all stuff that you feel is necessarily an indication of bad pain or damage, right? Like it is technically you are breaking down muscle tissue, right? That's
Mm-hmm.
built up. But I think for us, that's a good opportunity to educate, clients on sort of where we want to feel certain exercises and where we don't.
Yeah.
Okay.
What are your thoughts on like, because we're the industry itself, and I think this is a good thing ultimately, but the fitness industry itself, especially in the strength training area, is really moving into like heavy lifting. Everything I read, everything I hear trainers talk about, lifting heavy is like the key to success when it comes to strength training. Progressive overload, periodization type styles. What are
Mm-hmm.
your thoughts about like, two reps, reaching max, 3 reps, things like that, like super heavy, obviously on your big bilateral movements, your deadlifts, your squats is like what are your thoughts? Do you think it's like it's worth it to go in like super heavy, or do you feel like it's like, there are you can lift heavy without getting into that like super heavy 2 to 3 1 rep, range?
Yeah, I would say I more identify with the latter, part of that example where I mean, I think it is important if you're an athlete, let's say, and you're trying to work specifically on power and see, if you're power lifting or whatever. But I think for general population, it's probably not. I think the risks probably outweigh the rewards. I think you can definitely still gain tons of strength without getting to that level of a volume where you're just 2 rep max, 3 rep max. I think as long as you're working somewhere towards failure, and again, depends on your goal, right? Like we know, if we're in that like 5-6 reps, maximum range, we're probably working more on power versus strength and hypertrophy versus whatever
Right.
endurance. So I think there is something to that, obviously physiologically, but I think for a lot of people, it's a lot more about how hard they work and how much resistance they're able to provide or force they're able to build more so than like lifting super heavy. Because for example, you can get really really strong doing things that are more body, not even body weight, but just if you're doing like even an isometric or something like that, where you're as long as you're building tension and you're working towards failure, like you're gonna get strong.
Mm.
I don't
Right,
think.
time under
Yeah.
tension type of
Yeah,
Yeah.
things.
and I think especially
It's
if you
working more
know.
for intensity and not so much like ego lifting or
Correct.
yeah, yeah, yeah.
Yeah, I would say that. I mean, yes, it's the weights are such an easy, like visible um, proof that you're getting stronger. I think is a lot of it for people. It's like, okay, I can see that every week I come in on the bar, the weights are getting bigger. There's more of them or whatever. So I think there's some instant gratification there. But I think there's other ways to do it in terms of total volume. And I think just again, that's one of those where you have to know who you're working with. Like
Yeah.
certain people, if things are coming up for them semi regularly where it's like this starts to hurt and that starts to hurt, and if they have any especially history of, let's say, like low back pain or any sort of back pain, it's like the degenerative disc disease, whatever, like you probably don't want to like load their whole body a ton. There's
Mm.
other things that you can do that'll really load whatever tissues you want to load. If you really want to do like a super, if you want to do a squat because you really want to get a ton of quad or a ton of glutes, like you can load those muscles without loading the spine as much. So I think understanding their history and knowing like what parts of them do I not want to overly stress is important. For some
Yeah.
people, super athletic, they have no medical history. It's like, yeah, sure, what the heck, like go for it.
Yeah.
If they want to do that and it feels good for them, whatever. But I think it's just a case by case basis.
I
Yeah,
gotcha.
it seems lately, like 9 times out of 10, when somebody at the gym is complaining about back pain, and they usually don't. It's like a new thing for them. It's usually because like, oh, I lifted really heavy, and something tweaked
Pop.
there, and
Yeah.
now I got it back. Yeah,
Yeah.
yeah.
Well, like I said, risk versus reward, and then
Mm-hmm.
where we started today with just the threshold, right? Just did
Right.
more than your body is has been prepared for, right?
Yeah.
Education is needed.
Yeah,
But so,
yeah.
so take us to like an example when you assess somebody that does have low back pain. Or specifically, what are the specifics that you look for, and what are your assessment styles to like?
Yeah, yeah. I look at a lot of different things. I would say, where I usually start with somebody is just like a movement assessment. So I might even start with like just a toe touch, like just no equipment, nothing fancy. I just have them standing up, and then just go down, touch their toes, and come on back up. So with that, I'm looking at so many things. I get a ton of information from that. Number one is speed. How quickly are they moving? Right. If I see someone who's in back pain and I say, I'd like you to do a toe touch, and then they kind of like give me a look, or they look apprehensive, like that gives me a lot of information, right? If there's some hesitation, some pause. And then as they're going down, like, do they just like go right down, no problem, or are they moving slowly? Right, the slower they move, the more I'm contemplating,
Mm-hmm.
there might be some fear, apprehension.
Right.
I'm waiting for the pain to come, it's going to be here any minute, right? So that gives me a lot of information. I'm looking a little bit at like how low the hands get, but I'm not super concerned with that. I'm more looking at, are their hips moving, right? Are they able to get a posterior weight shift? Do I see the butt basically moving back in space? That's a good sign, right? If I don't, I'm thinking, okay, maybe the back of the hips are really compressed.
Hmm.
And then I'm looking at the spine. And the spine, I want to see like I want to see some flexion, just like we talked about. Like this is a
Ah.
movement where they should be relaxing into it. I
Mm-hmm.
want to see the spine bend and do like look like a rainbow. So if I see somebody who maybe their hips can go back, but they have that like perfect deadlift flat spine,
Yeah.
that's also a little bit alerting to me. I'm like, oh, okay,
Ah.
somebody
Interesting.
can't slouch, they
Right.
can't actually
Right.
like let their low back
Yeah.
muscles
And
relax.
most trainers might just compliment that, like, oh,
Right.
Yeah.
nice,
He's flexible.
Yeah.
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 Well, I don't know. I mean, yeah. And then there's when I see that too. Sometimes I see hypermobility with that. If like a dancer, let's say, if they're able to have like perfect neutral spine and touch the floor, and it's just like a really big hip hinge. I'm looking at their knees. Are their knees hyperextended 5-10 degrees? Same thing with the
Mm-hmm.
hip. Are they getting a
Hmm.
ton of hip? Are they, is their pelvis fully dumped forward? So that's not necessarily a good thing if they can do that. I'm wondering if there's too much slack in the system, right?
Mm.
So I'm looking for, those are the main two things, like on the way down, hips, low back. Are we getting movement? Are we getting space? Like we're basically in a toe touch. We're sort of closing up the front of the body and we're opening up the back of the body. So does
Yeah.
everything open up, right? Does the low back open up? Does the hips open up? And then, I'm also asking about pain, right? If you feel pain, when do you feel pain? Is it when you're on the way down? Is it when you're on the way up? Because those will indicate very different things for me. If someone's getting pain on the way down, that might mean that they're not really able to like lengthen those muscles, kind of like we were talking about earlier. They're not able to get stretch and relaxation of the low back lumbar erectors, right? And within that, where on the way down? Is it immediately? For some people, they'll just bring their chin to their chest or just like reach their fingertips 1 inch, and they'll feel like, ow, I feel my
Hmm.
low back. And then I'm thinking, okay, well, your low back muscles, like the low back section of your body, hasn't really moved yet. So we probably have a lot of compression of those erectors all the way up the spine, all the way into the neck area, pretty much, right? If they're
Mm.
just literally, bringing their chin down and they feel pain in their low back, I'm thinking, wow, okay, we have compression all the way up the spine.
Yeah,
So
man.
where they feel it is really going to dictate, what part of the spine actually needs the most amount of lengthening. Is it like,
Right.
upper thoracic, lower, are we into the lumbar? And then on the way up, if there's pain there, I'm thinking probably not a good force transmitter. They're probably not able to push through the ground very well and actually, create force through their legs more so than it actually being a back issue. So, just through something like that, a simple toe touch, I'm able to get a lot of information. And that's something that I would, advise for personal trainers to be looking at, especially like before you're doing a deadlift, before just as part of a an assessment to first visit, taking a look at something like a toe touch. And I go through all the major movements like we were talking about, Mike, all
Yeah.
the things. So I have them do a toe touch, I have them do a backward bend, where they're basically doing the opposite, right? They're closing the back, they're opening the front. Can they open up their abs essentially and their hip flexors, right? Can they get some stretch there? I
Right.
have them do a rotation each direction. I have them do a side bend each direction. I'm just looking to see, like, is there any movement restriction? Are they getting good curvature? Is there, can they move? Right.
Yeah.
So those are, great places to start with people. And then of course, like from there, I'll usually bring someone onto the table. I'm looking at more specific, hip range of motion, stuff like that. I'm looking at muscle activity, right? In terms of like, is anything in the chain not doing its job? And usually there's with someone who has back pain, almost always there's a few muscles that aren't really working the way that they need to be, aren't responding to the nervous system well, so to speak.
Yeah.
Hmm.
So, okay, so now let's say that, somebody has worked with you and they're cleared, right? They're ready to jump back in, you feel good about it, and but they still have that fear of,
Mm-hmm.
re-injuring themselves.
Mm-hmm.
But we know that like they're good to go and they can start at a lightweight, body weight, whatever it is, working through hip, knee dominant, blah blah blah. Um, and as trainers, we might get a little frustrated and want them to like, start to get the benefits of the exercises that we're putting out. What strategies would you suggest to help rebuild the confidence
Mm.
and in reintroducing sort of load safety for people and sort of letting them know like you're okay. We got to start working on getting these muscles activated. So basically to get them to trust you again. What are some of the strategies or verbal cues that you would suggest to give as trainers?
Yeah, you're saying like if I have cleared them and
Yes, exactly. Like you're good. Like yeah, they had a back issue,
Yeah.
say, and they're
Time to
good to
get
go
back on the
now, and they're
horse.
coming. Yeah, they're coming to me, and I'm like, okay, let's start off with a split squat or
sure.
whatever, something fairly benign, and they're just apprehensive about it, rotation through the hip, blah blah blah. But we know they're good to go. Like, what are some of the things that you could suggest that we would tell them in order to maybe boost their confidence a little bit?
Yeah, I mean, I would say if I've cleared them and they're coming to you and they're still pretty apprehensive and fearful, then I probably didn't do an awesome job.
Oh,
That's more on me than it is on you
yeah, yeah.
guys. And
Okay. So
that
I'll
would
just
be,
blame you next time.
yeah,
And like,
exactly. Just
We
blame
blame it
me.
on. Yeah, yeah.
'Cause
Our scapegoat.
that's
Harrison said it's okay. Just
Yeah.
do it.
It's Harrison's fault.
yeah. They're right.
Fair enough.
That's part of the process, right? Is like
Yeah.
getting the confidence back for sure. But I mean, again, like to that point, Mike, I think there is a point where it's like, okay, we've built some confidence, but obviously there is that return to like, okay, now we're maybe doing things a little more intense, more heavier, whatever. Like,
Mm-hmm.
because what you guys do is a lot like more like harder on them than what I do usually in terms of like just the
Definitely.
pace and the tempo. Like you're going to get different types of goals. You're trying to build their whole cardiovascular system. Like you want to get everything. And
Yeah.
I'm looking at like such a little thing. So I would say the biggest thing is, I think a lot of fear and apprehension comes from the unknown, right?
Mm-hmm.
So getting them on the same page with you, like through conversation, I think is a really good tactic. For example, say, hey, Jim, so glad that you're, back on my side and glad that everything went well with Harrison and things are getting better. Here's what I want to do. And I have a plan to get you back to where we were. We're not just going to jump right back into the same stuff we were doing the last time, you were with me or before the injury or whatever. It's like, we're going to be smart about this. We're going to be conservative. And this is my plan for you. And I want to make sure that sounds good to you. So, maybe step one of the plan is we're gonna start split squats this week, and we're gonna do it body weight, and we're gonna do it with a heel elevated. That way, you can stay a little more upright, so there's not as much stress on your back, right? Whatever. And
Yeah.
then next week we're gonna add 5-pound dumbbells. You're gonna feel silly. They're gonna be like little toothpicks in your giant hands. But I really want to make sure that you feel comfortable and we build you, whatever it is, right? Like
Yeah.
it doesn't even have to be a specific protocol. I think just having that conversation and letting them know, like, hey, I see you. I understand that you don't feel like, and I want you to know I'm not going to be like, pushing you all out, balls to the walls 100% from day one. Like, I'm going to help guide you there. I'm going to hold your hand. And then once we're there, then I'm going to push you really hard and be mean to you again. You know what I mean?
Yeah, right.
You got to
Exactly.
let them know.
Yeah.
It ain't
Yeah. I think
forever.
the biggest thing is that
Yeah.
fear comes from like, ooh, do they know? Do they know that I'm not, it's like if you just put it all out in the open and say, hey, I understand where you're at right now. And, I'm going to help you get there, and we're going to do it step by step. Because I think if you have a step-by-step system, like, or it doesn't even have to be a system. It's just like, hey, here's where we were at last time. We were doing, trap bar deadlifts at 135. And then we're just going to work back. We're just going to start at this weight. And then each week, here's the plan. So it's like, and if there's anything comes up, we take a break or whatever, right? We bring we take the weights off or whatever. So I think, again, that comes back to knowing who your client is. Some people, you got to hold them back a little bit, and other people, you got to give them, a little.
Some people will take those toothpicks, and that's all they'll ever do again. Right. And you want to be like, look, I don't want to hurt myself again. I don't want to go back there again. It's like, it's okay. You're not going to, but we got to start getting the muscles stronger so that you don't go, back there again.
Yeah. So again, just knowing your client is so crucial to this, but also, I think that fear really comes from, I don't know what's coming next, what they're going to do with me, what they're going to do to me, So it's like, if you just have that open dialogue, it's like, hey, we're teammates here. I'm trying to help guide you to where you want to go, and I'm going to do it in a way that, feels good to you. And like, you're the boss. If anything doesn't feel right, you let me know. Yada yada. But again, knowing your clientele, some people, you give them that speech and they're like, oh, cool, I can stay at the 5 forever. It's
exactly. Yeah. You're like, no, that's not how this works.
No, you will suffer.
Yeah, right.
Your muscles will thank you for it.
Yeah. But patient education is so crucial. It's such a great thing that you guys do, and I see you guys doing it all the time, not just in movement, but also, like we're talking about, getting to know what's going on in their life outside of that, helping them with their confidence mentally. And it's kind of the gym is sort of a microcosm of a person, what they have going on outside of the gym as well, nutrition, hydration, sleep, stress, like you guys are so great at being able to catch that stuff because you're with them 2, 3, 5 days a week.
Right.
So you really know where they're at, and they feel so comfortable with you guys sharing, some of that stuff. So you get to know them, and then you can kind of help understand where they're at and understand when they might need more of a push, and understand when they might need more of like a pat on the back. I think that's the art of what we do. So much of what we talk about on, podcasts and stuff is about the science, but I think, so much of it is really the art of
the lifestyle.
When you can push and when to push, and when you need to, kind of be a shoulder for them to lean on, type of thing.
Yeah. We're leading by example, and this is a lifestyle, and this is what we talk about. This is what we engage in. This is why we're always in tune to these factors, So it's like the other therapy. You got your mental therapy. This is the body therapy.
Yeah. Well, I think we all feel like therapists a lot of the time. A lot of our clients, and it is amazing. I think for people, that's a huge benefit that they get from working with someone like us who understands what's happening physically and can relay it to, and with a lot of, specifically, we're talking about back today, low back, man, so much of what I see comes from, I'm like, man, you have to change the situation you're in and your home life and your work life. Like, there needs to be a change there, because that's a big part of what I see with backs. It's a place where people commonly hold tension, that they don't get in the gym, but they get other places too. So, just to speak on that, another example of some sort of, an assessment or something that I look at with my clients would be like breathing, right? How well can they breathe? Like I get clients all the time who have back pain and everything seems pretty standard and normal. They're really good force producers. They, can lift a lot of weight and stuff. And I have them take a breath, and they can't take more than a 1 second inhale, or
wow,
1 second exhale. It's like super short breath. They're not getting any movement in their rib cage or their belly or their back. It's like, you can see it's just all super compressed. It's like, oh, well, tell me about what's going on outside of, the gym for you. Oh yeah. Well, I'm a CEO of a company, or I'm a, whatever, I'm going through a divorce. Yeah. Right. And so it's like, Okay. So, I think with low backs, with any, injury, really, it's so much more than just, what we see physically, what we see, through movement and stuff like that. There's a lot that goes into it. So yeah, the breath is a big part of it. Cause if the diaphragm's not moving, and the rib cage isn't moving, it's just really going to put a lot of stress and strain and contraction into the low back muscles, the pelvic floor muscles, all of that.
Yeah. Well, we'll give you one more little thing, and then we'll let you get out of here. I know you got your life to live here,
Yeah, that's
but
right.
so you had addressed a lot of what people do outside of the gym that can cause a lot of suffering from back pain. Is there like, say, your like top three, Harrison Kuehn, like advice tips
Mhm.
on people that do have these sedentary jobs or high stress jobs? Top three sort of like tips for them as as far as like trying to avoid some severe low back pain.
Mm-hmm.
I mean, you address breathing, obviously, and now I'm breathing like crazy because I'm thinking.
As soon as I said that, everyone's like,
I know. First, like,
what, can I take more than a 1 second exhale?
but is there like some hot tips that you could throw out there for people that then they could start maybe even incorporating into their, if they're sedentary or like you said, high stress
Right.
jobs that they can maybe incorporate into their lifestyles to help them avoid, your table.
Yeah,
Not
Mhm.
that I'm trying to, not generate business for you. Go see
yeah,
Harrison.
right.
Go see, but yeah, any hot tips for people out there?
Yeah, yeah. I mean, I think the biggest thing is, is to move. Like if you're not moving, that's a big problem.
Mm-hmm.
Movement is so key and crucial and huge, especially if it's a desk job. Most of the people that I see stopped moving a long time ago because of their initial injury, and then when I see them, most of the stuff we're working on initially, at least, is all of the compensation because of this sedentary lifestyle because of the initial injury. So it's like we're not even really like, it's not even the injury that's really the problem at this point. It's how their body adapted to the injury and how their lifestyle adapted. So the biggest thing I would say, number one, would just be movement. Like
Mm.
they need to be getting some amount of movement every day. And it doesn't have to be like structured, weight room stuff. I think that's a great way to do it because we talked about
Right.
the threshold, right? And that's how you increase the threshold. That's how you get a bigger ceiling so that you don't plonk into it as often. But even, start if you're someone who doesn't move at all, starting with just a walk, like 15 minutes a day, I think would be hugely helpful. Like walking is so good for your back.
Greatest exercise on the planet.
Right. Yeah.
Yeah,
I mean, just
yeah,
we talked about that sort of three-dimensional movement of the spine, right? The flexion, the extension, the side bending, the rotation. You get a little bit of that with walking every day.
yeah.
So I think that's just such an easy way to, work it into your day. So that's a big one. I think when I think of backs, I do think of what else is going on. So definitely, managing stress, I would say would be number two. And again, C number one, like
Right.
walking is a great way to just kind of decompress from whatever you're doing, especially, for our clients here in sunny Playa del Rey, California, it's like just never, there's never a bad time to go for a walk.
No, we're so lucky.
So lucky. There's no excuse not to, right? But yeah, I think, managing stress is a huge part of it. So for some people that I see, it's like, you don't even really need me. You need, I don't want to say like you need a therapist, but like, right. This isn't in the
Mm.
physical aspect. Like there's stuff that I can do to help, but really what's holding you back is, your processing of the pain or just like you're in fight or flight all the time. So that's when it's
Mm.
like those breathing strategies can really come into play to get you out of that, get you into the resting, digesting, parasympathetic nervous system. That's huge. So I'd say number two is just managing your stress, making sure you're having healthy relationships and just yeah, and that's really hard for some people to do. I have some clients who are just like, you know either their work situation or their home situation just doesn't allow for a lot of time to themselves, but it's like we just get creative with how can you get 5 minutes here or 2 minutes to
Yeah.
breathe before before your day starts or whatever, and that can be huge. um, then the third thing, I would say, on top of the movement would be, the threshold thing to me is a really big deal. I would say for somebody who doesn't have any tissue resiliency, that is going to just like put you at such greater risk. And so I put like this at 3 because I think it sort of comes third. You know what I mean? You can't really
Yeah.
build a lot of intensity through your exercise program until you're just doing the basics movement of life and just getting out of your chair. And then you're managing your stress appropriately. But then the third one I would say would be like build some tissue resilience, which means do some things that burn your muscles a little bit and
Mm-hmm.
allow you to start to build a positive association with feeling stuff in your body. Right? We talked about that. You'll see a lot of people say, "Oh, I think I have pain in my muscles." If they haven't moved in a long time, right? Some of it's just like they've atrophied. A little bit goes a long way in terms of building soreness. But the other part is like they don't understand that isn't necessarily a bad sensation to have, right? That's kind of
necessary.
Necessary evil.
That's the word we said, suffering, right?
That's right.
That's the suffering.
Yeah.
The
But again,
necessary
if you can do
suffering.
that, if you can start to like understand, oh, okay, and you have a great guide, one of the trainers at Real Fitness or somebody great who can help you, discern what is and what isn't. I think that really, really helps, and that's going to be like the sort of stay out of jail. Like the first two, the movement and the the breathing and the stress management can help get you out of jail, but the staying out of jail would be building that tissue resiliency through a really good strength training program. Those would be my top 3 for sure. I think
I agree.
That's awesome.
Those 3 I think would be very, very unlikely to get low back pain based on just a lifestyle thing.
Man,
just use your body, man. Do what it's meant to do.
That's right.
Well, we have to remind people.
Yeah,
we got to remind people
the simplest
thing is what drives us. The fabricated things, it was destroying us, and we have to get our heads straight. This is stuff I thought I was going to hear something, more, but it comes down to the fundamentals of prevention, which is move. My dad, just before, my dad is 86 years old, and he gets up every morning and stretches out in bed. He hugs bridges, I forgot what when the opposites are swinging out.
Bird dogs.
He does bird dogs in bed right before he gets out of bed. Because he knows at 86, when you get off the bed, it's like you got to crank it up.
Yeah, man. I see videos of him doing push-ups and all sorts of stuff.
Yeah.
I mean, I think that's awesome. I think, it almost doesn't even really matter, what you do. It does, especially if you're in pain, there's usually a reason why. And so, finding that root cause is very important. But for most people, if they're just like you're saying, like they're just in living a sedentary lifestyle, like don't overthink it. Just move, doesn't really just do something. And if you're just moving every day, I think that's the key. To your point, Lucho, I climbed Half Dome last year with a guy who was 79 years old, and it's a really tough hike, and it's very dangerous in moments. And that's what I asked him, like, man, he had no pain. He was, heavy pack. He does this stuff, and I was asking him, how are you able to do this? And he's like, well, I've just always done it. He never stopped, right? Like every year he's doing some mountain, some hike, some backpacking trip. Like, I think that sort of it was a really big lesson for me of like, as long as you stay in the game, whatever game that is, whatever you like to do, it doesn't have to be weight training even, right? As long as you continue to move and you don't stop moving, it's like, you're going to do all right,
You're going to do all right.
Yeah. And it's going to be great for all the other stuff, the stress relief, all that.
And support.
Yeah, even like you were talking earlier today, and about we were out in the beach and we were cutting and being spontaneous, and nothing was predetermined, and it wasn't like these specific movements that you have to focus on. It was all, and how you said like this is the kind of stuff that we sometimes just get away from. and it's like what you're saying, it's just get out there, get in the sunlight, and just move. It's
Yeah.
like it'll just do you a world of good.
Yeah.
If you can find something that you like to do too, like that's huge. Like I have
Yeah.
conversations with people, prospective clients, and I'm like, have you tried Zumba or something? Have you tried like,
Yeah, right.
like
Something you enjoy.
like
Yeah.
anything? Like, let's find something that like feels fun for you. Because if you don't do
Yeah.
anything at all, it's like you got to start with somewhere that isn't super scary. And if it's like, hey, okay, person who never moves, let's run, or like let's do like weight training. It's like that's for them probably not going to be. It's like you have to kind of get them into like the gateway drug first. It's
Yeah.
like,
Right.
oh, I'm playing pickleball. I didn't even realize it, but it feels really good to sweat. It feels really good on my body when I'm like,
Right.
Yeah.
moving side to side and running forward and cutting and all that. It's like, I think sometimes, you just have to find something that like you enjoy doing, and then, that really helps. And for us, I think it's so easy for us to be in the gym because we all enjoy it.
Right.
Maybe we didn't start enjoying it the first day,
Well,
or the first day in the weight room, I sat outside the weight room for 3.5 hours before I left because I couldn't move. And I hated it. I was like, I don't ever want to do this again,
Right.
So, it's one of those things, and now I love it. It's like, you have to find something that, that you like to do. And, had I had maybe a more, I don't know, a better coach, I probably would have had a better association with it right off the bat. But
Yeah.
I think so much.
You got to get over the
like
hump. You got to get over the hump too. And then when you start feeling the rewards, that's when it sticks with you.
Yeah, that's really true. Yeah.
Yeah.
For sure.
Well,
All right.
Well, that was. I think I had a good time.
That went by quick.
Yeah.
I can't believe how long we've been on here.
Good times. That's what happens when you have a good time, man.
So much great information.
Yeah.
Awesome. Well, thank you so much, Harrison, for your time. It's greatly appreciated, and I hope people get some insight here, and I hope they start moving and breathing, and then eventually, get to the gym. Well, they're probably already in the gym.
And if they need you, then know
but stay in the gym.
Yeah. And if they need you, they know how to find you right here at Real Fitness.
Yeah. Yeah. What's your can you plug your website?
Yeah. My website is hkathletictraining.com. HK, my initials, Harrison Kuehn, athletictraining.com. And I'm on Instagram as well, HK_athletic training. And you can also just call Real Fitness, and they have my number too. So.
All right.
Oh yeah, we got your cards right there.
All right. Harrison,
awesome.
It's great talking to you.
Thank you so much, man.
Congratulations again. Thank you for educating us. Enjoy the rest of your Sunday with your family.